Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today, we're going to be discussing stroke, a sudden and potentially devastating event that affects millions of Americans each year and which can lead to serious long-term disabilities. But instead of my usual routine of interviewing an expert on stroke, today we're going to take a different approach. I recently suffered a stroke myself, and as the host of this show, I thought it made sense to share some important information about this important subject by talking about my own personal experience. Honestly, I thought it might be therapeutic for me as well, kind of a way to make lemonade out of the lemons. And since I thought it would be better to hear somebody else's voice instead of mine exclusively during this episode, I've invited my own personal physician, Dr. Joseph Conigliaro, on the show to talk with me about it. Dr. Conigliaro has joined us before. He's the Chief of General Internal Medicine at Northwell Health and a Professor of Medicine at the Zucker School of Medicine. In addition to all of that, I'm very pleased to report that Joe has been my personal physician for the last 8 or 9 years, and I'm grateful for the wonderful care he's provided me. I'm also grateful that he's agreed to come on the show in this unprecedented role as guest host and help me talk through my recent experience. So, Joe, welcome back to Well Said, and thanks again for agreeing to come on the show.
Thank you, Ira. Glad to be here.
So I guess we should start by talking about what a stroke is, and then we can talk about my personal experience. So why don't you give some basic kind of instruction to our listeners about what a stroke is, and then we'll go from there.
A stroke is essentially when the blood supply to the brain is interrupted or reduced. And there's 2 predominant ways that you would have that. One would be what we call a vascular occlusion, and another would be a hemorrhagic or bleeding stroke. The vascular occlusion is the most common, usually about 85-87% of strokes, and the hemorrhagic strokes are usually about 13% to 15% of strokes. The vascular occlusions can occur as a thrombotic stroke, where the blockage occurs in the brain, in a blood vessel in the brain, as opposed to an embolic stroke, which is a clot or a plaque that develops somewhere else, such as in the heart, and travels up to the brain. And when it gets to an artery or a blood vessel that's too small to pass, it causes that occlusion or that reduced blood flow. Hemorrhagic strokes usually are an aneurysm or something called an AV malformation or an arterial venous malformation that can bleed. Those are the least common, but overall those are the types of strokes that you can have.
All right, so something either plugging up a blood vessel, typically a blood clot that comes from someplace else, or bleeding in the brain. Those are the 2 big ones, right?
That's correct.
Yeah. All right, well, let's take it from there then.
Most people experience a stroke as a sudden event. What happened to you?
Well, I had a sudden event. I was sitting in front of my computer screen, as so many people who are working remotely do every day these days, and I felt perfectly well, and I felt the sudden onset of a kind of funny sensation in the back of my head. Not quite painful, although it did develop into a headache over the next few minutes. But the really striking thing that happened, almost simultaneous with the onset of that funny feeling in the back of my head, is half of what I was looking at disappeared, meaning half the world in front of me just disappeared. That was, as you might imagine, a pretty scary thing. I knew enough to kind of check to see whether this was something wrong with my eye, meaning, is this just my right eye that's out of whack, or is it my left eye or something like that? So I covered one eye and then the other in turn, and it didn't make any difference. So it was not a problem with my eye, but I knew it was something more serious and concerning more likely my brain.
So when people get these symptoms, a lot of them delay getting help because they don't recognize that whatever is happening is serious. How long did it take you to figure out what was going on?
I mean, I knew it was serious right away because It was pretty striking. As I said, I was looking at a document on my computer screen, and I literally could only see the left-hand side of it. And the right-hand side was just like not there. Not black, not white, just like not there. So, I mean, I had never experienced anything like that in my life. So I knew that this was something that I needed to pay attention to. Now, obviously, I also have the benefit of being a physician and knowing about the different forms the symptoms associated with a stroke can take. And so I knew right away, within, a minute, that this was really not a good thing. And as I suspect we'll talk about a little bit later, I also knew that I had a particular and somewhat uncommon risk factor for a stroke. Truth be told, I knew within a minute or two that I was having a stroke. In fact, I remember sitting alone in my home office and saying out loud to nobody in particular, like, oh my God, I'm having a stroke. It was pretty apparent.
So take us through about what happened next.
It's actually a little challenging for me to resurrect all of the details. By this time, a bit of a headache. I mean, it wasn't incapacitating, but it just reinforced that there was something serious going on. I was alone at the time, and so I did what I think most people would do. I reached for my phone and tried to call my wife. And when I looked at my phone, I really couldn't figure out how to use it. Now, that's partly because my vision was so dramatically disturbed. I mean, I was still only seeing half of the world. And I think in retrospect, I was getting increasingly anxious and maybe a little confused. And so I probably wasted a good 10 or 15 minutes trying to figure out how to use my phone, which sounds ridiculous, right? I mean, we all use our phones a million times a day. It's not that complicated. But for whatever reason, at that moment, it seemed completely beyond me. That sort of increased my sense of anxiety, almost panic, really, because I thought, oh, my God, if this gets much worse, here I am alone. I got to get some help. I fortunately had complete control over my movements, right? So a lot of people who have a stroke have what we call motor impairment, meaning they get weak on one side or they can't walk or they faint, something like that. And fortunately, none of that was true for me. I had just this really kind of odd and somewhat scary visual disturbance. After about 10 or 15 very frustrating minutes, I basically gave up on using my cell phone, and we fortunately still have a landline in the house, and I just picked up the phone and dialed 911. And then I had the presence of mind to open the front door to my house so that when the EMTs came, they basically walked right in and found me sitting on the floor of my living room waiting for them to arrive. So what happened next was really all up to them. They were great, and they asked me what was happening. I was able to speak normally, and as I said, because I'm a physician, I was able to tell them kind of what I thought was going on and what my symptoms were in a pretty succinct way. And then I was taken by ambulance to a local community hospital.
Tell us about what they did.
Yeah, so, the most important thing in making the diagnosis of a stroke is to differentiate whether somebody is having one of those hemorrhagic strokes, bleeding into the brain, or an embolic or an occlusive stroke, meaning a interruption of blood supply to part of the brain. And that's because the treatment of those two is very different. I got kind of put into what is now commonly called a stroke protocol, meaning they kind of declared an emergency in the emergency department, and I was seen right away by a neurologist and whisked away within minutes of my arrival to get a CAT scan of the head. And I learned later, I was a little bit out of it at that point, that they actually took 2 CAT scans of my head. The first was done just kind of a plain imaging study, and then the other one where they injected some X-ray contrast, what we commonly call or refer to as X-ray dye, although it's not really a dye, in order to visualize all of the blood vessels in my neck and head. And so they looked at the neck because that's a common source of these small blood clots that can go to the brain. And then they looked at all of the blood vessels in my brain. Lo and behold, they found that a small branch of one of the arteries in the rear part of the left-hand side of my brain was blocked. presumably blocked by a blood clot, although I'm not sure you can always tell exactly what's causing the blockage in one of these kinds of studies. So I was in the CAT scanner within 10 minutes of my arrival of the hospital. That allowed the doctors to say, okay, here's a guy who has symptoms consistent with a stroke, and now we have evidence of an occluded blood vessel in the brain making the diagnosis of stroke, and then things unfolded from there.
So as a result of all that quick testing, you got a clot-busting drug called TPA, right?
Yeah, so it's a little bit, I don't know if ironic is the right word. So TPA stands for tissue plasminogen activator. It's a drug that was developed years back as a way to dissolve blood clots in the body. And I'm actually very familiar with that medication because years ago, we're talking 20, 30 years ago, that was first-line treatment for people having a heart attack because, just as an aside, a heart attack is also caused by a blood clot impeding the flow of blood to another vital organ, the heart. And so as a cardiologist in training decades ago, I learned all about that drug and used it to treat people who were having heart attacks. Subsequent to that, it became kind of the treatment of choice for people having strokes because in many ways it's a similar problem. It's a blood vessel occlusion caused by a blood clot, and if you get the drug into somebody quick enough, then it can dissolve the blood clot and allow blood to flow back to the area of either the heart or the brain that was starved for oxygen and nutrients because of the blood clot. I knew all about TPA as a cardiologist, and so the neurologist came into my room in the hospital. By that time, my wife, thankfully, had arrived on the scene. She said, you have a thrombus, and we got to it early enough that we think you would benefit from getting this drug. Are you okay with getting it? The reason why patients get asked that question, as opposed to just getting the drug, is because it's a pretty powerful drug, and you can imagine that the drug that is good at dissolving blood clots could also lead to undesired bleeding. And so there was a risk associated with getting the drug that what had been an occlusive stroke could turn into a hemorrhagic stroke, which would have been a catastrophe. But there were a couple of things in my favor that made me want to get the drug. One was that I had gotten to the hospital pretty quickly, and these drugs work better if they're given early, and the risk of bleeding goes down if you don't wait too long. And I didn't have any other particular risk factors for bleeding. So, there are folks who have, a history of prior problems with prior stroke or some other medical issue that makes them at risk for bleeding someplace else. The drug is given intravenously, so it doesn't know that it's being given to improve what's going on in your brain, so you could get bleeding any place. But I didn't have any risk factors for bleeding. I was still having pretty serious visual disturbance at that point, and it was early on in the course. And so knowing what I knew about the drug and its efficacy, improving stroke symptoms, I enthusiastically said yes to the treatment, which didn't take long to set up. It's given as an intravenous injection and then an infusion, meaning it sort of dripped into a vein over the course of about an hour. Start to finish, I would say I was very fortunate because the combination of recognizing the stroke symptoms right away, calling for help relatively quickly, although I'm still kicking myself that I wasted about 15 minutes there, quick response by the EMTs, and then quick response by the folks in the emergency department. All in, I got the drug started within about 90 minutes of the onset of my symptoms. And as you know, Joe, these drugs are useful up to 4 hours or maybe 5 hours after the onset of symptoms. And so, 90 minutes is considered a very quick response for this kind of treatment.
I've heard the neurologist use the phrase, time is brain.
Yes.
So
yes.
It's important.
I knew I didn't have a lot of brain to spare, so I wanted to get the drug as soon as I could.
So how are you feeling during all this?
Well, it was just so strange on many levels. Part of my visual disturbance had gotten better by the time I got to the hospital, so I didn't have that same overwhelming, like, oh my God, this is just devastating that I had at the beginning. So I was already kind of encouraged that things were moving in the right direction. I think I was also a little out of it, so that I didn't perhaps appreciate entirely the gravity of the situation, but I didn't feel badly. I had what I would describe as a kind of mild headache and this weird visual thing going on, but I felt like I was in the right place getting the right treatment, and I took quite a bit of solace in that.
Did you notice anything different when the TPA went in?
Yeah, I had a weird reaction during the TPA that I'm still talking to some neurology colleagues about, but I should start by saying when the infusion first started, I felt nothing. I mean, I couldn't tell anything was happening, and that's, I think, the general reaction that most people have to the drug. But about 20 or 30 minutes into it, I had this really strange reaction where I got kind of disoriented and had a very intense sense of deja vu that lasted for about 10 minutes. And in talking to some neurology colleagues after the fact, it may be related to the blood going back to the part of the brain where it wasn't going before. We're still trying to kick that around a little bit to see whether that's in fact the case. But other than that, my vision went back to normal. And after the drug was done, I'm grateful to say I had no complications from the treatment itself, so no bleeding or anything like that. My vision fully recovered.
Great. What happened afterwards? Tell us a little bit about your stay in the hospital.
Like most days in the hospital, it wasn't that pleasant, to be honest with you. I was admitted to the intensive care unit mostly for close observation. They didn't let me have anything to eat because they were concerned that even for the first 24 hours after getting this clot-busting drug, I was at risk for bleeding or for kind of worsening of my stroke symptoms. And so I guess the thinking was that if I needed emergency brain surgery, they didn't want any food in my stomach to complicate the work of the anesthesiologist. And they didn't want me moving around too much, so I was confined to bed. I had all kinds of wires attached to me, monitoring my breathing and my electrocardiogram. And the nurses were instructed by the intensive care unit doctors to check on me every hour to make sure that I was neurologically unchanged, meaning, they would come in and ask me a few questions like, what's your name? What's your date of birth? Where are you? What's today's date? Who's the president? All of those kinds of things to make sure I was still of reasonably sound mind. But you might imagine that all of that is a recipe for not sleeping at all. And so, I'd gotten to the hospital around midday. It was a pretty miserable night. In fact, the next day I kind of protested and made sure that they let me sleep a little bit. I ended up spending 2 nights in the hospital. My stay there was pretty uneventful. I had some follow-up imaging studies, so another CAT scan of the head to make sure that nothing had developed. I had an MRI of the brain, which is a different technique altogether, but allows the neurologist to see if there's been any significant damage or if there's other areas of the brain that were affected by this or possibly prior strokes. I walked out of the hospital about 48 hours after I was wheeled in. So, look, I'm very grateful for how this all played out. I had about as smooth a course in the hospital as you could possibly imagine.
So they did some more testing. Did they ever figure out why you had a stroke?
Yeah, well, that gets back to what I said before, and part of the reason why I think I was able to figure this out as quickly as I did. Joe, as you well know, I have an unusual heart condition, also somewhat ironic, I guess, as a cardiologist. And I had known for some time that heart condition put me at increased risk for a stroke. I have a small sort of outpouching at the tip of the main pumping chamber of my heart called an apical left ventricular aneurysm. It's a small area of the heart that's not contracting very well, not contracting at all. And so that's kind of a potential source for blood to just kind of sit around as opposed to moving quickly through the heart. And whenever blood is kind of sitting around, it clot. And so I put 2 and 2 together, more or less immediately and thought, okay, my left ventricular aneurysm developed a small clot and then it traveled from my left ventricle up into my brain. Subsequent tests of my heart never actually showed a clot there, but that's often the case. So the working diagnosis is still that I had a small blood clot, or what we call a thrombus, form in that part of my heart. Just through the normal beating action of the heart, it dislodged and found its way to a small blood vessel in my brain.
Given that history of your heart and now that you've had a stroke, what sort of implications does this have for you moving forward?
The biggest change is that I'm now on a blood thinner. So, we call these drugs blood thinners. They don't actually thin the blood out. What they do is make the blood less likely to clot. There again, I think my timing was pretty good because there are now a family of drugs that are much easier to take than the older version of drugs. So many of our listeners may be familiar with a drug called warfarin or Coumadin. Warfarin was the only anticoagulant blood thinning drug that was available for many years. I'm sure when you and I were training, we put plenty of patients on that as the only blood thinner that we had available. But it's a difficult drug to take. It interacts with a lot of other drugs. It's difficult to regulate. You have to take regular blood tests to see if you have the right amount of drug at any given time. And so that's been largely supplanted by a whole slew of what we call newer oral anticoagulant agents, or NOACs. Novel oral anticoagulants is what the acronym stands for. So I'm on one of those. One pill once a day. I don't have to take any fancy blood tests to see if it's working. It's pretty easy in that sense. I don't feel like the treatment is a nuisance. Obviously, blood thinners by their very nature make it more likely that I could have an episode of bleeding. So I have to be a little bit careful, and I'm not inclined to try to go downhill skiing or skydiving or
Right.
anything where I might have a traumatic event. Kidding aside, obviously, if I were to have something even as mundane as a car accident, that could take a much more serious turn because I'm on a blood thinner. Day in, day out, I don't feel any different. I'm grateful that it's there doing its work, preventing another one of these things from occurring.
It's always hard for us doctors to be on the other side. What did you learn from being a patient?
Well, yeah, that's a really good question. And I would say rather than, kind of what I learned, I'd like to believe I had a few things reinforced, meaning that, if you'd kind of held me down and asked me these things, I would have known them to be true before, but it took on new meaning for me to be the guy lying flat on his back in the bed instead of the guy in the white coat standing next to the bed. I guess a couple of things stand out. First is that, being in the hospital is a pretty miserable experience. Even under the best of circumstances, it's very anxiety provoking, and it creates this incredible sense of vulnerability and dependency. And so that creates, I think, a special burden on the people around the person in the hospital bed to acknowledge that, to understand that they're dealing with somebody who's feeling really vulnerable and really frightened by and large. I was incredibly grateful for the kindness and the attentiveness, especially of the nurses who implicitly understood that I was in a frightened, vulnerable state, and that, they treated me accordingly and were very attentive to my needs and thoughtful about their approach. The other thing I would say is that time moves very differently for patients and doctors. The doctors and nurses are busy, they're running around, they got things to do, and they're dealing with lots of other patients, and the patient is just sitting there doing nothing. And so this sense of time elongating and waiting and waiting and waiting and hanging on, waiting for information, that was really quite extraordinary. And that sense of kind of waiting for the doctor to come in and either tell me what was going on or explain what the next step was. And again, even though I knew most of what was happening and what to expect, I still felt like it was really important for me to see the doctor, hear what he or she had to say. And I needed that comfort, that reassurance, that information. It was really quite astounding. And I guess the last thing I learned is that sometimes you do have to stick up for yourself. And that second night in the hospital, I basically put my foot down and said, "You're not checking me every hour." And I was able to get some sleep. And I think that was an important part of my recovery as well.
Good advice for such a harrowing story and experience. What other advice would you have for our listeners?
I think the most important advice I would have is don't delay. I had an unusual presentation, which is that I had just a change in my vision. I didn't have any slurred speech. I didn't have any weakness. Those are other things that people should really be on the lookout for. If you or a loved one has the sudden onset of something serious not right, meaning you can't talk, you can't walk, you feel some weird sensation, you can't see. I mean, these are serious medical issues. Delay can be really costly. So I think it's really important to pay attention and make sure that you get medical attention quickly if something like that happens. I'm living proof that getting medical attention quickly for an important and potentially debilitating stroke can lead to a great outcome.
Great advice. Definitely will help people save a life. I have one other question. It's really hard to talk about healthcare and healthcare delivery without talking about COVID. How did COVID play a role in this?
Honestly, I think my timing was once again exquisite, that this happened right before the latest surge in COVID in our communities and in COVID hospitalization. So thankfully, it really didn't play much of a role at all, although I think if I had gone to the hospital just a few weeks later, who knows? I mean, I think it would have kept my wife from being able to be at my bedside. I think I would have potentially had a significant delay in my care that could have led to a much worse outcome. So for me, it's just even more compelling reason to tell everyone to please get vaccinated so that you're not competing for space in the emergency room with people like me who are having a stroke or a heart attack or in a car accident or any other calamity that, of course, is continuing along regardless of what happens with the pandemic. So me personally didn't have an impact. I kind of threaded the needle there. But for lots of other folks, it can have a devastating effect. And so please get vaccinated, please get boosted, and stay the heck out of our hospitals.
People forget that it's not just about the pandemic. Strokes and heart attacks are still going to happen.
Yeah, absolutely. I think we've come to the end of our time. Thank you so much for joining me today and taking me through this. I really appreciate it.
Thanks for the opportunity. It really was a kind of scary but fascinating story.
Well, again, my guest or my host today has been Joe Conigliaro. He's the Chief of General Internal Medicine at Northwell Health, Professor of Medicine at the Zucker School of Medicine, and my doctor, which I think is, from my perspective, his most important title. So, Joe, thanks again.
Thank you, Ira.
For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.